For 20 years, women were told that estrogen therapy, after 60, causes breast cancer and heart attacks. But new research is changing everything. We now know that the original study that scared everyone in 2002 had major flaws, specifically regarding the age of participants. Today, top menopause experts are revisiting estrogen therapy, not just for hot flashes, but for brain protection, bone strength, and heart health longevity. By the end of this video, you will know the truth about the risks, the benefits, and the timing hypothesis that matters most. This is controversial. Many doctors are still afraid to prescribe it, but you deserve to know what the current science actually says today. I am not a doctor. I am sharing published research from journals like The Lancet and Menopause. Always consult your doctor before starting hormones. Let's go back to 2002. The Women's Health Initiative study was stopped early because researchers saw increased risks of breast cancer. Headlines screamed, "Hormones kill." Millions of women stopped taking estrogen overnight. Doctors stopped prescribing it. It was the end of an era completely. But here is what the headlines missed. The average age of women in that study was 63. Many were over 70 years old. They started hormones 10 or 20 years after menopause. Their bodies had already aged without estrogen. Their arteries had already hardened with plaque. Giving high-dose synthetic hormones to a 70-year-old body that has not seen estrogen in decades caused problems. That makes biological sense. But for younger women closer to menopause, the data showed something different. It showed protection. This led to the timing hypothesis scientists use now. If this kind of honest health information matters to you, hit subscribe right now. I make videos like this every single week here. So what does the new science say about starting estrogen after 60? Is it safe? Is it beneficial? The answer is nuanced. Generally, starting systemic hormone therapy for the first time after age 60 or more than 10 years after menopause is not recommended anymore. The risk of heart disease, stroke, and dementia increases if you start late. Your estrogen receptors have changed. Your blood vessels have changed. However, if you started taking hormones in your 50s and are now turning 60, the guidance is different. You do not have to stop. The North American Menopause Society says there is no arbitrary age limit for stopping hormone therapy. It depends on your personal health and symptoms. Many women continue taking bioidentical hormones well into their 60s and 70s to protect their bones and brains. Under strict doctor supervision, obviously. There is also a big exception to the no start after 60 rule. Vaginal estrogen. This is local therapy. Not systemic, it is safe. Vaginal estrogen does not enter your bloodstream in significant amounts. It stays in the tissues. It treats dryness, painful sex, and urinary infections. Urinary tract infections are a major cause of hospitalization for women over 65. Vaginal estrogen restores the tissue barrier, preventing these infections. Most urologists and gynecologists agree that vaginal estrogen is safe and underprescribed for women over 60. It improves quality of life dramatically for many. Now let's talk about the forms of estrogen, because the synthetic hormones used in the 2002 study are rarely used by experts today. The old study used Premarin, pregnant mare's urine. It contains potent horse estrogens, and Prevera, a synthetic progestin. These cause the side effects. Today, experts prefer transdermal estradiol, patches, gels, sprays. These are bioidentical. They match the exact molecule your body produced when you were young. Transdermal estrogen bypasses the liver. This lowers the risk of blood clots significantly compared to oral pills. It is much safer for older women. Instead of synthetic Prevera, experts now use micronized progesterone. This is safer for the breast and mood. It also helps with sleep quality. So if your doctor says hormones are dangerous, ask them which hormones. Are they talking about old horse pills or modern bioidentical patches? Now, if someone you love is suffering from menopause symptoms, share this video with them right now. They need to know options exist. Let's talk about benefits. Why would a woman over 60 consider continuing hormones or fighting to keep her prescription? The benefits are structural. Benefit 1. Bone density. Estrogen is the most powerful bone-protecting agent available. When estrogen drops, bone loss accelerates rapidly, leading to osteoporosis. Women who take estrogen have significantly fewer hip fractures. A hip fracture after 65 carries a 20% mortality rate within 1 year. Benefit 2. Brain health. Estrogen is a neuroprotective hormone. It fuels brain energy metabolism. It reduces neuroinflammation. It supports synaptic connections in memory centers. Some research suggests that women who start estrogen early in menopause have a lower risk of Alzheimer's disease. Timing is critical for this benefit. Benefit 3. Heart health. Estrogen keeps arteries flexible. It lowers bad cholesterol. It reduces plaque buildup. Again, timing matters. Early start protects hearts. Benefit 4. Muscle mass. Estrogen supports muscle stem cells. Women lose muscle mass faster after menopause. Estrogen helps preserve strength and prevent sarcopenia, frailty. Benefit 5. Skin thickness. Estrogen increases collagen production. It keeps skin thicker and more elastic. This prevents tearing and bruising common in older skin. Now, let's talk about the risks honestly, because hormone therapy is not risk-free. Even the modern bioidentical types carry some specific risks. Risk 1. Breast cancer. This is the biggest fear. The data shows a small increase in risk with long-term combined hormone use. However, the increase is rare, less than 1 extra case per 1,000 women per year, and mortality from breast cancer did not increase. Interestingly, women who took estrogen only without progestin actually had a lower risk of breast cancer in the long-term follow-up studies. Risk 2. Blood clots and stroke. Oral estrogen increases clot risk. Transdermal patches do not seem to carry this same risk in studies. Risk 3. Endometrial cancer. If you have a uterus, you must take progesterone with estrogen to protect the lining. Taking estrogen alone is dangerous. Risk 4. Gallbladder disease. Oral estrogen increases risk of gallstones. Patches avoid the liver first-pass effect, so the risk is much lower. Who should absolutely avoid systemic estrogen? Women with a history of breast cancer, history of blood clots, liver disease, or unexplained vaginal bleeding. For these women, non-hormonal options exist. New drugs like Viaza treat hot flashes without hormones. Lifestyle changes also help manage symptoms effectively. So what should you do if you are over 60? Scenario 1. You are already on hormones and feeling great. Do you stop? Talk to your doctor. If you are low risk using transdermal patches and monitoring bone density, you may be able to continue safely. Scenario 2. You are over 60, never took hormones, but have hot flashes or bone loss. Should you start systemic therapy now? Generally, no. The cardiovascular risks of starting late usually outweigh benefits. Look for non-hormonal options for hot flashes and specific drugs for bones. Scenario 3. You have vaginal dryness, urinary infections, or painful sex. Should you use vaginal estrogen? Yes. It is safe and effective. Vaginal estrogen cream tablets or rings are local treatments. They restore tissue health without raising systemic levels significantly. Talk to your gynecologist. Scenario 4. You want to prevent dementia naturally. Do not start estrogen just for brain health after 60. Focus on exercise, sleep, and diet. What about phytoestrogens? Soy, flaxseed, red clover. These are weak plant estrogens. They can help mild symptoms and are safe for most women. Eat whole soy foods like tofu or edamame. Avoid highly processed soy supplements. Whole foods provide a balanced mix of compounds your body recognizes. The most important takeaway is this: menopause treatment is personal. There is no one-size-fits-all answer. It depends on your history. Find a doctor certified by the Menopause Society. They know the latest research. They won't just dismiss you because of your age alone. Do not suffer in silence. If you are struggling with symptoms, there are safe treatments available, whether hormonal or non-hormonal. Ask for help. Now, if this video helped you understand hormones better, I need you to do 3 things for me. They cost nothing and help. First, hit subscribe and turn on the bell notification. I post honest research-backed health content every single week, specifically for people over 60. Second, share this video right now with a female friend over 60. The fear around hormones has hurt too many women unnecessarily. Third, drop a comment below. Tell me your experience with menopause or hormones. I read every comment personally, and your feedback helps this community. Next week, I am covering the 5 chair exercises you should do every morning to stay flexible. Simple movements to start your day right. Subscribe now so you do not miss it. Staying flexible prevents pain and injury. It is a critical part of aging well and happily. That is it for today. No fluff, no gimmicks, no lies. Just honest truth for people over 60. Stay informed. See you next time.